Okay, so this is the history taking management plan station for you. So do you want to read this station?
Yes, 1-year-old child Jishan is brought with history of fever, skin rash, and itching by mother Ria. Take a focus history and discuss the management plans.
Yeah, 1 minute for reflection. Okay.
Okay.
Let's begin.
Okay. Good evening. I'm Dr. Dinesh, one of the pediatric doctors here in the hospital. Am I talking to Mrs. Ria, mother of Jishan?
Yes, doctor, this is Ria.
Okay. Is it the right time to talk to you?
Yeah, doctor.
Okay. You won't have any problem if I take down notes?
Yeah, I don't have any problem.
Okay. Can you tell me what concerns you are having about Jishan that you have come here?
Yeah, doctor, as you know, Jishan is having the skin allergy and so which has flared up for last few days. Is itching like hell. He's not sleeping and it's oozing from the side, So I'm very much worried what is happening with Jishan.
Okay. So from how many days have you noticed this rash?
Yeah, actually, this skin rash is there since beginning, doctor. Like almost when he was around yeah, 3 4 months, it's going on. But now it's a new kind of skin rashes actually. So there are some yellow, some yeah, I'm worried that some pus like things are there in the skin.
Okay. And he's having itching over that area?
Yeah, itching is there.
And any blood also is coming out from that area or not?
Sometimes, yeah, when he scratches in the night, like he can, yeah, there is a oozing.
Okay. So this rash is there only over the face or any other part of the body?
Yeah, so or the hands or the legs.
And all these rashes are there for how long? Like you said, ki on the face, it was there from 4 months of age.
Yeah, legs and face it's there for a long time, and yeah, hands. Yeah, so recently for last 1 month it is.
Okay. Anything that you have noted causes an increase in the rash and increase in the itching, like use of any particular soap or anything like that?
Yeah, we are using baby soap only. So his towel is also separate, and but still it is increasing. I don't know what could be the
Did you
reason.
go to any other place like you traveled or there was any dust which made it increase?
Yeah, you're right. Just 1 week ago, we went to cousin's house, and yeah, that is only journey we did.
Okay, so after that it has increased after you went there.
Yeah, I feel like that.
Okay, and where was the cousin's house?
It is in London only, doctor.
Okay. So have you noticed that his rash increases like when he's exposed to dust or anything like that?
More than dust, I feel like whenever too much cold is at that time, it worsens, doctor. Yeah.
Okay. Or have you noticed it increases to after he eats any particular food, like any chocolates or anything like that?
I feel yeah, peanuts, whenever like peanut is there in the food, that time I feel it increase.
Okay. And he's having at present fever also.
Yeah, yeah, you're right. Yeah.
Okay.
Last
And
two.
this fever is there for last 2, 3 days.
Yeah, yeah.
And what is the degree of fever? Have you measured that? What is the degree of fever?
Somewhere between 37 and 2 to 38 degrees Celsius.
Okay, mild fever is there. And
Mm.
what about the fever's pattern? Like it is present throughout the day or any particular time?
Yeah, most of the times he's warm to touch only, doctor.
Okay, you gave him any medicines for that and how it gets relieved?
Actually, yeah, for this actually we consulted GP, and he gave local some antibiotic treatment cream, and but however it's not improving, doctor.
Okay. And he has any other problem like any cough or cold frequently?
No, doctor.
Okay, he does not have frequent cough, cold, or any wheezing sounds when he's having a cold, like you were saying. So does he develop any wheezy chest or requires any intervention for that?
When he was 6 months old, that time he had flu-like symptoms, noisy breathing, and fast breathing was there. Yeah.
Okay, so he required admission for that.
Yeah, he was admitted for 3 days.
So what did they tell you, what he's having at that time?
Some viral infection in the chest.
Viral infection. Okay. And is there any problem with his pee or poo, like his urine and this thing, stools?
No, I don't have any concern, doctor.
Okay. And what about his vision and hearing? That is normal.
Yeah, yeah, it is.
Okay. And he has any other complaint like racing of heart or anything like that?
Hmm, I didn't notice actually. Yeah, but sometimes when I keep my hand over the chest, I feel like he's racing. Yeah, I feel.
Okay. This you note at what time? Like when he's having fever or otherwise also?
Yeah, yeah, whenever there is a fever.
Whenever there is fever. Okay. That
Yeah.
can occur sometimes. Okay. And is there any like hyperpigmented marks over his body other than this rash? Anything else like he's having?
No, no, the rest I noticed, doctor.
Okay. And in your family, anyone else is having similar type of illness?
Similar means your skin allergy you're asking?
Like, yeah, yeah, yeah. I'm asking about that.
No, we don't have any skin allergy, but my wife is having asthma.
Okay, wife is having asthma. And she's taking any inhaler or anything?
Yeah, yeah.
For last how many years she's on inhaler?
Yeah, last many years actually. I don't know exactly, but many years.
Okay, and like now I would like to ask you, like when he was born, so he was born normally, or was there any problem regarding the pregnancy or delivery?
No, everything was all right. There was no problem at that
Uh,
time.
okay, his tests were done at that time, like we do the test at day 5 for different illnesses. Everything was normal at that time.
Yes, yes, yes.
And any concern you had regarding his development? Like he started walking at around 1 year of age, like normally children do, and other milestones were also normal.
No, I don't have any concern about his milestones.
Okay. And what about history of allergy? Like you are saying, he's having allergy to peanuts. So is he allergic to any specific medicine also, or anything else he's allergic to?
Only we notice worsening of the skin rash, itching with the peanut. Yeah.
Okay.
Yeah.
Otherwise, there's no other positive allergy
No.
history.
No.
And you have given him all the vaccines.
Yes, yes, he's vaccinated.
And other than the routine vaccination, any other specific vaccine he has been given, additional vaccines like flu vaccine or this thing?
We didn't give vaccine till now. Is it mandatory to give?
It is not mandatory, but sometimes we give in certain specific conditions.
Okay.
And how many this thing members are there in your family?
Total 4 members are there in the family.
You, your wife, and one more child you are having.
Yeah, yeah. So
And
my elder daughter is there.
okay. And what do you do for this thing as far as your job is concerned?
Doctor, actually, I'm working in a police department.
Okay. So your earning is sufficient to meet your family needs.
Yeah, to be able to.
Okay. And you are not this
Last
thing requiring
payments left.
any help, any financial help from the government you are not receiving.
No.
Okay. Now I would like to ask you like about your house and all. So how many rooms are there in your house, and your house is well ventilated?
Yeah, yeah. We have 3 BHK house, well ventilated. Yeah.
You or your wife, anyone smokes in your house?
Yeah, we both of us spoke.
Okay. And you were saying like your wife is having this asthma. So anyone else is having any allergic disorder in the form of like thyroid disease or any this thing, diabetes or anything like that, Addison's disease, any disease anyone is having?
Yeah, my wife is having thyroid problem. She's on thyroxine, eltroxin.
But skin problem, no one else other than
No,
the child.
no.
Okay. At any time, he has required admission in hospital, Jishan.
I told you when he was around six
Okay.
months that yeah.
When he had that respiratory illness. And
Mm-hmm.
other than that, he has not been. And any
No,
investigations have been done on him, like when he had this problem. So any tests were done, any blood tests.
they did X-ray and some blood test. Yeah, they took some swab from the nose.
Okay. So what did they tell you? What any positive result or a result showing any illness?
I don't remember, sir. They some virus.
Okay. When he was admitted, only at that time.
Yeah.
But now when you took him to the GP after he developed this problem, so at that time anything was done.
No, he didn't do anything, but he told that he might need some blood test, and he sent us here.
Okay.
Okay.
Completely.
So, do you want to
You have
summarize
any
your
other,
history?
yeah, you have any other concerns or you want to tell anything to me which I have missed?
I am not able to recollect now, doctor. If I recollect, I'll let you know.
Okay,
Okay.
okay.
Could you
Thank
please summarize your history? Thank you. Could you please summarize your history?
Yes, today I had the opportunity of taking history from Ria, mother of a 1-year-old child Jishan. And Jishan is having history of rash. This rash has been there on his body, more on his face, and it has increased for last few days. The problem started at 4 months of age, and on and off he was having rash. But from last few days, it has increased. It is oozing from the sides, and it is there's some yellowish discharge like pus from there, and there's itching also he's having, and blood also is coming from that. And there's also a history of fever along with the rash. And there is no other positive history as far as the rash is concerned. Only that mother has noted is that the rash, it increases after eating peanuts. And there is no history significant in the form of any breathing problems, any pee or poo problem, or any other this thing in the form of hyperpigmentation of the skin. The family had consulted the general practitioner, and he had advised some creams to be applied. There's only one history of admission in the hospital. That was most likely for the bronchiolitis. Other than that, there is no significant history.
What is your
In the
impression?
My impression is that it is most likely a case of eczema, which has got infected now by bacterial infection. And there is a positive family history of allergy in the form of by a mother of the child having asthma. She's on inhaler, and she's also having thyroid illness. That is an autoimmune illness. And because of the prolonged long history, like this history started at 4 months, so it is most likely an eczema illness which has got worsened due to the bacterial infection.
Okay, okay, okay. So any other differential diagnosis you can think?
Differential diagnosis other than eczema, sometimes it can be because of just bacterial infections. Sometimes it can be because of immunodeficiency. And sometimes like we can get this Scott-Eldridge syndrome, in which
What
we
is
get
that? What is
uh,
Scott-Eldridge syndrome?
in that what we get is repeated episodes of atopic dermatitis, and thrombocytopenia is there, and repeated infections are there. Then there can be this rare possibility of hyper IgE syndrome and any immunodeficiency. Immunodeficiencies also can present with repeated eczema.
Okay, 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 okay. So, all right. What about hyper IgE syndrome? See something about what is that?
Yes, hyper IgE syndrome, in that case, usually we get repeated eczema. The faces are coarse, and repeated infections occur because of IgE levels are very high, but the levels of the protective immunoglobulins, G levels, that are low. So sometimes there can be formation of abscess, pneumatoceles can be there in the chest, and
Okay, okay. So, clinically, how will you make out? Other than this is history, like, do they catch up the growth, or how they will uh, their
in the
present?
case of eczema, there will be repeated episodes of eczema. So we have to give them advice for hygiene, and there should be separate towels. The nails should be kept
No, no, no.
short.
I'm asking. So clinically, how will you know the child is having immunodeficiency disorders, or it is just a eczema, case of eczema?
In the case of immunodeficiency, when we examine the child, we may get other findings like in the form of hepatosplenomegaly can be there, lymphadenopathy can be there. So we can distinguish. Whereas in the case of eczema, we will not get any other positive finding.
What about growth parameters?
Growth parameters in the case of immunodeficiency, growth will be affected. His height will be low and weight will be low. And in case of eczema, his growth parameters will not be affected.
Okay, okay, okay. All right. Uh, so, did you ask any treatment going on for this skin eczema for lot because it is there for a long time? Did you ask any ointment, cream, anything?
Creams they are applying off and on. They were saying that when they took advice from the general practitioner, So the general practitioner advised them to apply creams. And he had advised some tests also, but till now they have not got the tests done.
Okay, okay, all right. So now how do you manage him?
Management will be a multidisciplinary approach in which I will involve the pediatrician and the dermatologist, the skin doctor will be involved. And depending on his overall condition, at present he's having infection. So I would get the investigations done. Investigations in the form of full blood count, CRP, blood culture will be done as he's having fever, and other inflammatory markers in the form of CRP, ESR, we will get done. And for allergy conditions, I would like to get his total IgE level done. And I would like to start him on
Why you want to do total IgE?
Just to see if he's having allergic disorders. And then I would like to start him on seeing his general condition and his age. I would like to start him on intravenous antibiotics. So for that, I will admit the child and inform my consultant about this child.
What antibiotic?
We can give him this thing, flucloxacillin, which covers for the usual organism is Staphylococcus aureus. And then for application of at the local site, we can use this fusidic acid can be used at present. And later on, he will require this thing, steroids also to be applied locally.
Okay, okay. So now, so after your treatment things, and now he's better, like the rashes are better. So further, how do you educate father about managing eczema at home? How do you
Yes,
counsel them?
I will advise him to not to use this thing soaps, and there are Syndet-based soaps available which can be used, and then liberal use of emollients. I will advise him that they should use emollients on
How do
this
you use?
Jishan, and
How do you? How do you use that?
emollients we can advise them to apply on the body, and depending on the severity of the case, like we can advise them to apply 6-hourly also, and if it is very severe, so then even 4-hourly application of emollients can be done. And if there is the nails should be kept short, and they should avoid dust. Separate towels should be there. And we are suspecting this thing, food allergy in the form of peanut allergy. So we should advise them not to give peanuts to the child. And both father and mother are smokers, so we should advise them to, it is better to stop smoking.
Okay. So what is the difference between the cream and ointment?
Cream and ointment, usually cream has this thing, liquid formulation, and ointment is usually just for applying at a small place.
Okay. So do you want to prescribe any steroid cream for John?
Yes, we will prescribe steroid creams, and depending on the intensity, we have to prescribe. Like there are different types available, mild one like hydrocortisone, then moderate like beclomethasone and betamethasone, and if it is very severe, so then we can use clobetasol.
Okay, okay. All right. Over the face, which one would you like to advise?
Over the face, we usually apply mild steroid because it causes thinning of the skin. So
What
we
is that?
don't usually
Which one is the
apply.
mild one?
Mild one is the hydrocortisone.
Okay, okay. All right. Now child is not responding. Child has come back again after 2 weeks, 3 weeks, not responding, and rashes are increasing. Itching is there. So his sleep is disturbed. So further, how do you manage?
If he's not responding to even the high potency steroids, so then we can use tacrolimus. Tacrolimus can be used, and sometimes it shows good effect in case of eczema.
Which group of drug is that?
It is a calcineurin inhibitor.
Okay, your time is over. All right, let's go to next session.